Shown here are the right and left lungs from the anterior view. The right lung consists of 3 lobes, the upper, middle, and lower. And since the left lung has the cardiac notch which holds the heart, there are only 2 lobes, the upper and lower. This is a lateral view of the right and left lungs. Again, the right lung has the upper, middle, and lower lobes, and the left lung has just the upper and lower lobes. Lastly, we have the posterior view of the left and right lungs. Both the right and left have just the upper and lower lobes accessible from this view. In these videos, we are demonstrating locations for stethoscope placement to hear lung function over each lobe of the lungs from the posterior, lateral, and anterior aspects of the thorax. The diaphragm of the stethoscope should be placed over 3 points on each lung for the posterior aspect of the thorax. These will be positioned to listen to 1 spot on the upper lobe of each lung and 2 spots on the lower lobes. For the lateral aspect of the thorax, you want to listen to 2 points on both sides to hear both the upper and lower lobes of the lungs. Lastly, on the anterior thorax, you will listen to 3 spots on each lung. For the right, these 3 spots will include listening to the upper, middle, and lower lobes, and on the left you will listen to 2 spots in the upper and 1 spot in the lower lobe. There are 3 normal breath sounds that can be heard with auscultation. Bronchial sounds are shown here in red, and these are heard over the trachea and main stem bronchi. They should be harsh, loud, high-pitched sounds with a 1:2 to 1:3 inspiration to expiration ratio. Bronchiovesicular sounds are shown here in dark green. These should be intermediate pitched sounds with a 1:1 inspiration to expiration ratio. The last sound is vesicular sound, shown here in light green. These should be a soft, low-pitched sound with a 3:1 inspiration to expiration ratio. Now we will demonstrate what a patient exam will look like. Auscultation is started on the posterior aspect of the apex of the lungs and should continue around to the anterior aspect. It is important to position the patient in an upright seated position and have them lean slightly forward. The patient is asked to breathe more deeply than normal through their mouth for a full inspiration and expiration when the stethoscope touches their back. The diaphragm of the stethoscope is used on all points of the lungs mentioned earlier in this video. It is important to listen to 1 complete respiratory cycle, meaning 1 full inspiration and expiration at each point of auscultation. You should alternate sides to compare the sounds for each lung. Any presence of abnormal or absent sounds should be noted, and patient modesty and draping is especially important throughout this whole process. For the purpose of shooting this video, we auscultated the right and left lateral lungs individually. However, when done on a patient, it is important to alternate sides so you can compare the sounds bilaterally for both lateral sides. Once all the spots have been listened to using the diaphragm of the stethoscope, you can switch the stethoscope over to the bell and listen to all points again to hear lower pitch sounds.